Hey future doctors, welcome to Dentistionary. Here, you will be provided with information for the doctors from the doctors. Today, we will be learning about a process which we all go through from our transition from child age to a mature adult age. That is tooth shedding. So let's dive deep into it. It is a process which most of the mammals go through and have the two types of generations of teeth. The first one is milk teeth or the deciduous primary dentition, and the second one is permanent dentition or the secondary one. It is a physiologic process that results in the elimination of deciduous dentition or the milk teeth called shedding or exfoliation. Why there is a need for shedding? The jaws of an infant are small and deciduous teeth are also small. As the child grows, the jaw grows. And as the jaw grows, teeth can't increase in size after they have formed and erupted. So there can be no change in your teeth. Then what will happen? The muscles of mastication also increases in size and also the power of contraction, that is the masticatory force, increases as the child grows. Then what will happen? The periodontal ligament of deciduous teeth can't withstand the increase in the force of mastication. That will need a more number of larger and stronger teeth to withstand the greater masticatory forces for the adult. So what will happen? The permanent teeth, which are larger in number and stronger than the deciduous ones, will erupt, replacing the deciduous teeth. And for this to happen, there is a physiologic process called shedding. It is a permanent molar tooth germ which is increasing and developing between the two roots of the deciduous first molar. This is your deciduous first molar. And the first permanent molar is developing right here beneath this. What is the pattern? The resorption of anterior teeth root begins in a lingual surface, whereas in case of molars, area between the roots get resorbed first, that we have seen in the previous slide. That this is largely due to the position of the underlying tooth germ where it lies, as we have studied in the first video of the dental histology, that is the development of tooth. We have studied about the developing bud and where does it form. That will help you understand this, which later on lies directly beneath the roots. Resorption is not a continuous process, it takes time. During rest periods, cementum-like tissues is deposited by cementoblast-like cells, where we will know about these cells in later. Process continues to the crown with dentition and enamel getting resorbed. So dentin and enamel will get eventually resorbed by the erupting tooth. Dentogingival junction migrates along the inner resorbed surface and holds the tooth in the cervical region just before shedding. So why they don't fall off on their own and just get stuck into that, and we have to just remove them forcefully or sometimes. So why does that happen? Because the gingiva or the gums hold that crown, the resorbed crown, from the cervical region. That's why it's hard to fall or to shed them off easily. The cells of periodontal ligament undergo apoptotic cell death. This is a generalized main events. Cementoblast layers damaged by inflammatory process due to release of factors by reduced enamel epithelium, REE. We have studied about it in the first lecture. Odontoclast attached to the hard tissue surface peripherally through clear zone. We have also studied about that in the first lecture, development of tooth. A sealed space is created and lined by ruffled border of cells. That is to be noted. We will know about these cells later. Membrane of ruffled borders act as proton pump, adding hydrogen ions to extracellular region. This makes that region acidic, and the acidification and minerals are removed. Which minerals are removed? The inorganic minerals or inorganic part will be removed by this acid reaction. Lysosomal enzymes degrade the organic matrix. When the inorganic matters get resorbed, so what will happen? There is exposure of the organic matrix, which is digested or degraded by the lysosomal enzymes that releases from the resorption of another cell. Increased forces of mastication with increase in jaw size, then this will lead to trauma to the periodontal ligament of the deciduous teeth. There will be degeneration of the PDL. Okay. Odontoclast and the mechanism of resorption. This is a proper mechanism. Odontoclast similar to osteoclast. Osteoclast do resorption of the bone. Odontoclast does resorption of the deciduous tooth. Apart from being multinucleated as the osteoclast, it has numerous vacuoles and mitochondria, especially adjacent to the ruffled borders. The ruffled border is very important. The clear zone peripheral to the ruffled borders shows contractile proteins actin and myosin. So it has contractile proteins named actin and myosin. Odontoclast and osteoclast have similar origins. They are derived from monocytes. Odontoclast similarly resorb all dental tissues as osteoclast resorb bone. This is to be noted. Hydrogen ions released from the ruffled border dissolve the inorganic portion and liberated lysosomal enzymes degrade the organic component. This is the main event. The cells of the periodontal ligament and teeth undergoing resorption express rankle. Rankle is linked to it. What is rankle? You will know it in our previous slides of pulp and periodontal ligament. Periodontal ligament have defined it well. Shedding is a genetically programmed event in development influenced by local factors. The local factors are pressure to odontoclast formation and activation exerted by the developing successor's teeth and increased masticatory force of the developing adult, which the deciduous teeth can't withstand. This is an important point. See how this works? The deciduous molar is getting resolved and the crown portion is still intact with the gingival layer here. Then contact between the deciduous teeth and the permanent tooth, enamel of the premolar. So this could be the first molar. There is bone resorption of the older teeth and formation of new bone in the newer teeth. So gingiva will get reattached right here. So what are the similarities to osteoclast? Odontoclast have large multinucleated giant cells of variable shape, occupy resorption, base or lacunae, show ruffled borders and clear zone peripheral to it. Cytoplasm adjacent to ruffled borders show a high amount of mitochondria and vacuoles. Acid phosphate activity within vacuoles. Process of resorption is similar. Origin is similar from trap and circulating monocytes. Odontoclast differentiation promoted by Rankel and inhibited by OPG. Now, what are the dissimilarities? These are smaller and contain fewer nuclei than osteoclast. Produced smaller resorption base, resorb dental hard tissues like dentine, cementum, and enamel. Seen, therefore, on surface of dentine, cementum, and enamel, which are to be resorbed. So, these are only seen on these surfaces. These are seen also in the palm chamber and the root canal of resorbing deciduous teeth. Clinical considerations: the remnants of deciduous teeth, sometimes part of the roots of deciduous teeth, are not in the path of erupting permanent teeth and may escape resorption. So that's why there are over retained tooth that remain intact and does not get resorbed. So we have to extract them. Such remnants consisting of dentine and cementum may remain embedded in the jaw for a considerable time until and unless you just stimulate them to fall off. They are most frequently found in association with the permanent premolars, especially in the region of the lower second premolars. The reason is that the roots of the lower second deciduous molar are strongly curved or divergent. The major distal diameter of the second premolar is such much smaller than the greatest distance between the roots of the deciduous molar. So they are very tightly curved and the premolar bud is so small, or they can even here. This is the root and it is developing here. So this does not get resolved if the bud is here and it is developing. This will not get resolved. The reason is that roots of lower second deciduous molar are strongly curved. So what will happen then? The root remnants may later be found deep in the bone, surrounded by an ankylose to the bone. Frequently, they are cased in heavy layers of cellular cementum. When they are close to the surface of the jaw, they may ultimately be exfoliated. Progressive resorption of the root remnants and replaced by bone may cause the disappearance of the remnants. See, this is how the remnants of the deciduous molar are embedded. See here, this is very specially carved. Okay, retained deciduous teeth. Deciduous teeth may be retained for a long time beyond their usual shedding schedule. We have studied in previous slide. Such teeth are usually without permanent successors or their successors are impacted. They are invariably out of function. Retained deciduous teeth are most often the permanent upper lateral incisors, less frequently the second permanent premolar, especially in the mandible, rarely in the lower central incisors. If a permanent tooth is ankylosed or impacted, its deciduous predecessor may also be retained. This is most frequently seen with deciduous and permanent canine teeth. If the permanent lateral incisor is missing, the deciduous tooth is often resolved under the pressure of the erupting permanent canine. This resorption may be simultaneous with that of the deciduous canine, so it may simultaneously occur. Sometimes the permanent canine causes resorption of the deciduous lateral incisors only and erupts at its place. So sometimes the permanent canine replaces the lateral incisor and erupts on its place. In such cases, the deciduous canine may be retained distally to the permanent canine. A supernumerary tooth or an odontogenic tumor may occasionally prevent the eruption of one or more permanent teeth. In such cases, ankylosis of deciduous teeth may occur. Supernumerary teeth are of different kinds. So look how the second deciduous molar is here, which is retained, and we have here a deciduous teeth. Here we have impacted and retained permanent teeth. See, also here and here in the mixed dentition. Submerged deciduous teeth. Trauma may result in damage to either the dental follicle or the developing periodontal ligament. If this happens, the eruption of the tooth ceases and it becomes ankylosed to the bone of the jaw. So, what does it mean? When there is a trauma, you get hurt on your mouth, someone punched you. What will happen? Either dental follicle or the developing periodontal ligament may get damaged. If this happens, the eruption of the permanent tooth ceases there and it becomes ankylosed to the bone of the jaw. Because of this continued eruption of neighboring teeth and increased height of the alveolar bone, the ankylosed tooth may appear shortened or submerged in the alveolar bone. That's why it's called impacted. Submerged deciduous teeth prevent the eruption of the permanent successors or force them from their position. They will emerge somewhere else. Submerged deciduous teeth should therefore be removed as soon as possible. So, if uh, a child has a pain, you have to check for the x-rays if there is a submerged deciduous teeth because it is painful. If the permanent one is erupting beneath that, that will disrupt the eruption and it will result in very heavy pain. Thank you for watching. I hope you found this video useful. If you want the PPT, follow the link below. And if you have any doubts or queries about this video, please comment down below. We will try to solve it as soon as possible. You can also tell us or DM us on our Instagram page. Thank you so much.